Hi everybody, this is Matt. I am going to start with the individual segments of the conduction system now, and we will start with the sino-atrial node, also known as the SA node, and also known as the pacemaker of the heart. So we will go back and revisit what we did on the last presentation in regards to, and I'd like to thank again my former colleague, Professor Sesto in Germany, Mannheim, Germany, for this Arrhythmia Compendium number 2, Arrhythmia Compendium number 2, and this is where we have the content in regards to anatomy of the conduction system of des Herzen, or of the heart. So we are going to focus today on the sinus knoten, or the sinus node. And the sinus node, again, is located at the juncture of the inferior aspect of the superior vena cava, or just as it enters the right atrium, and the most upper part of the right atrium, right there. Okay? So, the SA node is the control center for the start of a normal heart's electrical activity. It does this about 60 to 90 times a minute if you're doing like I'm doing, sitting here. Of course, if you're sprinting down to catch a bus at the bus station or the bus stop, it responds to the change in demand by increasing the rate. And that's a very clever system, but it has the capacity to be able to speed up when you have higher demands and slow down when you have less demand. But the minimum, approximately, that it keeps your heart beating 24 hours a day is about 60 times a minute. Some people, like athletes like moi, at night can have a heart rate down in the 40s, and that's normal for them because they have a very trained heart. And trained hearts, if you want to get motivated to exercise, beat in general more slowly and more efficiently. And what happens there is the heart slows, the left ventricle fills more completely, and because of the Starling effect, it springs back like a rubber band, and whoosh, the blood flows more vigorously out to your body and brings that oxygen to every cell that's waiting to pick it up and get rid of the waste products that it has, those cells have produced. So, okay, that's essentially what the pacemaker does. The pacemaker initiates an electrical signal 60 to 90 times per minute, and the signal goes out from that area at the juncture of the superior vena cava and the right atrium in a wave-like fashion. A wave-like fashion. Exactly in the same fashion as if you took a stone, boing, into a little pond of water, and those wavelets spread out rhythmically. And that happens 60 times to 90 times a minute. That wave-like transmission of that electricity is the depolarization of all the myocytes, and that travels down through the atria and over to the left atria as well through the Bachmann's bundle. It's a little trivia. Bachmann's bundle is a transmission from the right atria over to the left atria, and then downward to the atrioventricular node. So that's kind of the substance of the first part. That's the SA node. Sometimes the SA node does not work well. you can't trade it in. Well, you can kind of trade it in. You can buy a pacemaker. Pacemakers are not cheap. Pacemaker implantations are well established. They actually started 50 years ago, and it was developed by a Dutch physician, and that development was the roots of the company Medtronic, who I work for in Europe. Very good company. And they historically, and the physician who, I think it's Dr. Bakken, if I'm not mistaken, that those were the roots of pacemakers. Pacemakers, when they first started, were implanted in the abdomen because they were like a hockey puck. And for those who have played hockey, hockey pucks are fun to hit with a stick, but you don't want one in your belly controlling your heart. So now pacemakers are implanted just under the skin, here below the shoulder blade. They're about the size of a silver dollar, roughly, and they're very small. You can still see a little bit of a lump after they're implanted, but that would be what you might require to have, that is, an implanted pacemaker. If your natural pacemaker, the Sino-Atrial node, the SA node, is not working right. Okay, so that's a whole other topic. We'll get into devices in a later segment of this whole production. And that is essentially what I wanted to make note of for the SA node, that it is located on the upper part of the right atrium, that it beats normally 60 to 90 times a minute. Those impulses go out in a wave-like fashion across to the left atrium and down to the AV node, and it causes the contraction of the myocytes and initiates in that part of the heart the emptying of the atria into the ventricles. So that's part one, and I'll be back with the AV node in the next session. Have a good day.